Okay, today we're going to be going over the stand lift, okay? Some of the nurses have taken to calling him Stanley the stand lift. He is definitely my best friend as far as helping us to move patients and keeping them safe and not hurting ourselves by having to lift people. So some important features to know, okay? First off, this button here, or this window, lets you know whether it's charged or not. Okay, there's 4 batteries. If they're all lit up, it's fully charged. You can still use it if they're not all lit up. But currently, we're all charged up. This is the safety button. If you push that button, okay, you're going to see empty batteries, and the machine is not going to work. So I go to push the machine up and down. It is not going to work. To release this, you simply twist the button, and it comes undone. So if you come upon the stand lift and it is not functioning, check this button first. If this button's pushed in, just twist it off. Check the window. If it's fully charged, it will then work. Okay? So that's very important. A lot of times, oh, the machine doesn't work. The safety button's pushed in. Check the button first. Okay? This is the remote control. Okay? It's very simple. You've got 2 features, up and down, or the legs make going narrow or going wide. Okay, so if I push this button, the arm's going to come up. If I push the one with the arrow going down, obviously the button's going down. The legs widening, the legs narrowing. The good thing about these legs, if I'm standing next to it, it's not going to push into my leg and try to move me. It's just going to make the other leg go wider. Okay? So you don't have to worry about running it into anything. Okay? The brakes on the machine are right here. You simply push down. Okay? To release them, you just kick them up like so. Okay? This is the plug. On this machine, this is missing. There's usually a place to hang the plug right here, okay? The next safety feature is this red button right here, okay? If for whatever reason you did not check the battery and the machine is stuck in the up position and there's a patient in that machine, don't panic. You reach down through, you lift this button up, and it will release the arm. Okay? The thing about what I'm demonstrating right now is that there's no patient in this. Okay? We'll demonstrate this again with somebody in it. The patient's weight will pull that down. Okay? But this button, you pull that up and it manually releases the hydraulic. Okay? Other features, when you sit somebody down in this machine, you're going to need to adjust this pad, okay? This is just like a seatbelt, you take that out, this is going to go behind their legs, just clip it in place, and then just give a little pull. It doesn't have to be super snug, okay? Some legs are not going to fit perfectly in there, or if there's a lot of swelling and edema, you don't have to put it right up against their legs. To adjust this pad, you turn this knob, okay, and then you move this up and down to get to the desired spot. And then you retighten it. To loosen it this way, or to move it forward and backward, you loosen this knob, and the whole complex will move forward and backward. Okay, every stand lift also has 2 slings, okay? When you hold the sling up, you're going to see it like this, okay? You see the green tag and then this white tag. There's an arrow on the tag, shows which way goes up. The rounded part always goes up on the patient. So you're going to put it around the patient when they're in the chair, like so, okay? See where it says what you're looking for. This is the medium size, arrow up, okay? The other one is large. It's the green tag. arrow up, and you can see where it says large right there if you're ever not sure, okay? The inside of these pads has this little indoor belt, or this little inside belt. This is how you know what goes inside the patient. So they're going to be here. This will close like so, and it's just a simple little button. Okay, this is not currently on right, so we'll just take this out. Okay, to tighten it, just lift and pull a little bit. What I like to do, it's easier when it's off the patient, is to pull like so, and then get it to be a little snug, okay? This also does not have to be super snug, okay? If their abdomen won't allow it, okay, or they have a colostomy or an abdominal incision, you do not have to make this super tight, okay? A little bit of looseness is fine, okay? Okay, so those are the slings. So approaching the chair, obviously you can see the legs are not going to fit underneath. So in this typical chair, I'm just going to narrow this out, or excuse me, widen the legs, and I'm going to bring this in, okay? You always use two people, right? So as someone's sitting there, if they can't lift their legs up, then they're going to get run into by this foot plate. You need to ask the patient to put their feet up on the plate. If they cannot do so, then one person is driving in, the other person is going to lift their feet up on the pad. Okay? The patient will be in the chair, like so. Their feet are going to be up here on this plate. You loosen this strap. Plug it back in, okay, and then pull that tight, okay? Now at this point, the brakes are going to want to be put on. You step on the brakes like so, okay? That way, as the patient goes to maneuver or hold on to things, you're not going to have them sliding all around, okay? At this point, now the arm, how you attach this, okay? And whenever you want to learn how to use this on your own, go ahead and take a minute and pop yourself into this machine, okay? This button will lift and we'll slide this arm in and out, okay? You just find the hole and then you know it's secured, okay? You place the sling around the patient. Clasp the inside, okay? Now these need to go underneath the patient's arms. They do not go over the top. They go underneath the bar on both sides, okay? This little clasp is going to move. You take this strap, put it around this steel ball and down, around the steel ball and down, okay? Now this is going to close. As this arm lifts up, this is going to stay down. Okay, now, just a quick question for those of you who are watching. What did I not adjust before I lifted myself? A little minute to think about it. I didn't adjust this. Okay, I showed you the buttons here and how to adjust it, but I didn't do it before I got in it. Okay? What you want to think about is when the patient is sitting, you want to find their kneecap and then go just below the kneecap. So I've got about another inch, inch and a half that I can raise this up to give myself support, okay? So I would loosen this and raise that up. There's my kneecap, I go just below, and now I'm in a better position, okay, to support my knees. I can readjust these. Again, it doesn't have to be super tight on the leg strap, okay? Now we're ready to go, okay? So you got one person just guiding the patient, you got somebody else driving. You have to ask the patient to hold on right here. Okay, go ahead and hold the handles. If I want to pull them closer, I can lift this up and push this in until it locks down again. Okay, now they're in a little bit better position. Now they're going to hold on. while we lift. I'm not going to do a whole lot. I'm just going to kind of let the machine do it. I'm going to help a little bit, okay? And I'm just lifting up. My legs are working to help the machine out. And I'll tell the patient, please go ahead and stand up with the machine as it lifts you up, okay? I get them to this point, and now the brakes can be undone. I can slide them out and move them over to another chair, to a commode, back to the bed, anything I want to do. Once I line them back up, I just hit the lower down button, and down we go. Now, back to that spot for the safety button. If I'm in this position and I get stuck right here because the battery ran out, okay, for whatever reason, I just lift this up, okay, and you can see my body weight is just lowering me down, okay. It's nice and slow so the patient's not going to just drop. Once their bum is in the chair, this will stop and you'll have to keep pushing it down with a little bit of force to get it to go the rest of the way down if you're manually lowering it. And now we'll go up again, okay? Please hold on, all right? A couple different things. If you start to see the patient and they're not doing anything, okay? The patient can't participate. You're gonna start to see them doing this, okay? The thing starts to slide up. They're probably yelling at you at this point. It hurts their shoulders. Okay, if you see this out of somebody and they're just sliding down, then this probably is not the machine for them. The patient has to participate a little bit, enough to start to get themselves into this kind of position for this machine to be useful. Okay, so they have to help. If it's a non-participating patient, somebody who can't do anything, this machine isn't going to work and we need to use the full patient lift. Okay, and you'll know because if you start to lift somebody up, this is what you're going to see. Okay? Once they're upright, my raisin box, once they're upright, okay, and they're able to engage some and help themselves stand, okay, I'm not going to fall out of this, right? If I start to go, right, my knees get blocked. I'm literally trying to fall out of this and it's not going, okay? Now those of you noticing what happened to me when I started to go down, well, my forehead starts to come toward this. And so one thing I would change about this is having a pad here, okay? This is also why we have two people. One person's driving, the other person can hold this patient's forehead to make sure it doesn't hit there. Some of the older patients who might have a very kyphotic spine, you want to make sure that their forehead doesn't hit that bar, okay? So now I'm up, I'm not going to fall out of it. I'm blocked, even if they start panicking, okay? I'm just hanging here right now. My knees are blocked. But if I don't get up to this position, then there's nothing for me to block, okay? Take the patient out. I can again lift this button and pull this out, which will give me some slack. You may need to help the patient lean forward. You slide that little button here, and then you just remove these straps. Okay? Then the one thing that I always forget to do, not always, I'm getting better at it, but you start to pull this machine away, don't forget to take out the leg strap. Why isn't the machine coming? Well, it's still attached to the patient. So remove these, then undo the leg strap. Okay, just pop the brake with your foot, our mystery feet here. And then as you slide this away from the patient, their feet will just kind of naturally slide off. If someone's having a lot of pain, you can help hold the painful leg, but generally speaking, it will just gently kind of slide their legs off. Okay, so now just to show you how easily this can be done. First, we're going to put this around the patient. So Jung, just lean forward if you can. Good, lift your arms up for me. Okay, it's a little short, so we're going to make that a little tighter. Okay, that's good to go. Okay, I'm going to bring this in. If you can, just lift your feet up for me and put them on this plate. I'm going to make the legs wide so they go around the chair. Okay, go ahead and scoot yourself to the edge. So once I get it in here, I'm putting the brakes on. Okay, I'm going to find his kneecap. We need to slide this down a little bit. There's his kneecap. There's the pad. We're all set. I'm going to unhook this. Pass it behind. When there's another person with you, which there always should be, it's easier obviously to have somebody to pass that through. Give that a little tug. I'm going to take this, I'm going to put it underneath the handlebars. 1, 2, make that slot go. I'm going to lift this button, slide it in. Jung, go ahead and put your hands right there. Okay, I am going to leave the brakes on while we lift him up. I push the button, go ahead and stand with the machine as much as you think you can. We get the patient to an upright position. The second person's just going to watch his head, make sure we don't hit that. I'm going to release the brakes. Okay, I can now slide him out. If I need to go to the commode or the bed, I can maneuver the legs as I move him. Okay, go wherever I need to. It moves very easily. Okay, one person guiding the patient, one person steering. We go back up to our destination. Okay, Jung, we're going to lower you down. You can go ahead and sit with the machine. As they sit, just make sure their forehead doesn't hit on this. Once they're down, I'm going to lock the brakes again. Okay, I'm going to loosen this. Good. Have him come forward just a little bit. Remove the straps. Unhook from the patient. This will slide right out. Then I got to release his legs, the most important part. Slide this out, undo the brakes. Okay, and then as you move it, his feet are just going to gently come off the foot plate, and there we go. Okay, it's that simple. Everything on this machine is wipeable, okay, and it is very important to wipe this machine down, okay. If you come in here and you look at the handle, right, a lot of people have dead skin. That's going to get left in here. Skin on the pads, skin on the thing here, on the foot plate. If your loved one was going in there after somebody was using this, wouldn't you prefer it to be clean? Okay, so when you're done, you take everything, you just get the Cavi wipes. Okay, it's very simple. Just wipe everything down. You can time me and see how long this takes. I mean, it might take another minute. Nobody should be too clean. Nobody should be too good to clean the machine off. If your mom or grandmother or dad were going to go in this machine next, would you rather it be clean or dirty? I know the answer for mine.